If I told you that your acid reflux could be silently setting the stage for cancer, would you believe me? Most people treat acid reflux as an annoyance. A little bit of burning, sometimes digestive discomfort. Nothing serious, right? You just pop a Rennie and you'll be fine. But here's the disturbing truth. Some forms of acid reflux, especially the ones you can't feel, and one common stomach infection, have been directly linked to cancers of the esophagus and the stomach. In this video, I'll show you the hidden chain reaction, how a single bacteria can lead to stomach cancer, how silent reflux can lead to esophageal cancer, and the early warning signs that are easy to miss until it's too late. Make sure you stay to the end. I'll reveal a single symptom that most people ignored before diagnosis. Hi, I'm Reese Mander. I have a master's in clinical nutrition. I'm the founder of the Good Gut Nutrition Company and a former reflux sufferer. I spent years helping people fix their acid reflux naturally, and one thing I've learned is this. If left untreated, acid reflux can go from harmless to dangerous fast. Today, I'll connect the dots between acid reflux, bacteria, and cancer and show you what to do before it ever gets that far. Now, most people think that acid reflux is simply too much acid, but that's a myth. In many cases, it's actually insufficient or low levels of stomach acid, which stop that lower esophageal sphincter from closing, leaving acid in the wrong place. It's now in your esophagus instead of inside your stomach. And unfortunately, that acid can creep up for years, sometimes without the burning symptoms. And that's what makes it dangerous. The damage isn't always obvious until it is. Think of it like a dripping tap corroding a metal pipe. It won't burst overnight, but given enough time, it will. And that's exactly what silent acid reflux and H. pylori have in common. Hidden damage that builds up quietly over time. Let's start with Helicobacter pylori or H. pylori. This spiral-shaped bacteria that lives mostly inside the stomach is believed to exist inside half the world's population. Most people have no idea they have it. And in fact, in a lot of people, it doesn't cause any issues at all. I'd leave it well alone. However, in some people, H. pylori can slowly damage the protective lining inside the stomach. Over time, that irritation can lead to gastritis, stomach ulcers, and in some people, if left untreated, stomach cancer. It's officially classified as a group 1 carcinogen. That's the same category as asbestos and tobacco. A 2020 meta-analysis confirmed what was found in earlier research. H. pylori is responsible for up to 80% of stomach cancers. It does this by changing how the stomach cells grow after damage. Imagine a very tiny spark that never goes out, constantly creating damage. That is H. pylori. And because it can alter stomach acid levels and your microbiome, it changes the entire chemistry of your digestion. But here's where it gets even more unsettling. Reflux and H. pylori often show up together, and the combination can make things far worse. While H. pylori damages the stomach lining, it also produces an enzyme called urease, which suppresses your stomach acid levels, allowing it to survive. This acid suppression stops your lower esophageal sphincter from closing and allows the acid to come from the stomach up into the esophagus, causing acid reflux. Now you have acid in the wrong place, and that constant irritation starts to damage the cells of the esophagus. Over time, the esophagus responds by growing tougher, newer cells, a process called metaplasia. This is the body's attempt to protect itself from the acid. This condition is precancerous and is known as Barrett's esophagus, and unfortunately can be the stepping stone to esophageal cancer. This can also start with something called silent acid reflux. No pain, no burning, just irritation of the esophagus. It could show up as throat clearing or a dry chronic cough, mucus, or postnasal drip. Sometimes it's difficulty swallowing or a lump in the throat sensation. For more signs of silent acid reflux, I have linked a video in the description below. So here's the sequence that nobody talks about. Silent acid reflux, micro injuries to the esophagus, Barrett's esophagus, and esophageal cancer. In fact, Barrett's esophagus can increase the chance of esophageal cancer by between 30 and 125 times compared to normal people. And what's scary is that you can develop Barrett's esophagus without the traditional heartburn. By the time those symptoms appear, the changes have already begun. But there's good news. this isn't inevitable. If you catch and treat the triggers early, especially H. pylori, the chain reaction can often be reversed. So how do you stop this chain before it starts? Step number 1, test for H. pylori. In our experience and the gold standard testing, endoscopy is by far the best test for detecting H. pylori inside the stomach. In our opinion, breath testing, blood testing, stool testing aren't anywhere near as accurate as an endoscopy, and often show many false negatives. It is also important to note that the science says you have to be off your PPI medication for at least 15 days before you have your endoscopy. Otherwise, you have a 56% chance of a false negative. That's more chance of an incorrect result than a correct one. So speak to your doctor about coming off your PPI medication before you go for your endoscopy. In our clients who are positive for H. pylori, we use Pylopurge to reduce the H. pylori populations. And this has allowed thousands of people to kill the H. pylori and avoid antibiotics at the same time. It is important to note that H. pylori can silently live inside the mouth and inside the esophagus, interfering with that lower esophageal sphincter, causing your problems, but without showing up in an endoscopy. Currently, there is no test for H. pylori in the mouth, on the tonsils, on the teeth, on the tongue, inside the esophagus. With our clients, to rule this out, we take the Pylopurge capsules, put them into water, ask you to swish them around your mouth, gargle and swallow to rule out any H. pylori hiding in those areas. If antibiotics are your thing and you prefer to use those, you will need a positive test from your doctor. It is also worth noting that over time, this bacteria has started to become more and more resistant to antibiotics, which is why the standard triple therapy in some regions is now quadruple therapy, followed by multiple rounds of antibiotics. Step number 2, buy yourself some relief. While you're trying to get to that root cause and see if you have H. pylori, there are lots of lifestyle changes that you can make to reduce the symptoms of reflux or silent acid reflux. Staying upright after eating, limiting alcohol, sleeping on your left-hand side, eating smaller meals. I will link in the description below a video that shows many different lifestyle tips that you can use to control your reflux. Step number 3, never ignore silent symptoms. Throat clearing, chronic cough, post-nasal drip, lump in the throat sensation, voice hoarseness could all be signs that you have acid coming up and irritating that esophageal lining, so absolutely get it checked if you have any of those symptoms. In almost everybody I saw with silent acid reflux caused by H. pylori in the mouth, in the esophagus, inside the stomach, that they ignored was chronic throat clearing. Sounds a little bit like this. And it made especially worse after eating. If you sound like that after eating, or you have a chronic cough after eating, those could be signs of silent acid reflux slowly damaging your esophagus that could lead, if untreated, to esophageal cancer via Barrett's esophagus disease. Often when I worked with people before, they didn't even realize that these were signs of acid reflux. They just put it off as a cough or some sort of dry throat or dehydration. And it could be those things, but it's much better to get checked just to make sure those things are nothing more serious. So here's the acid reflux connection in plain English. H. pylori infections can lead to chronic gastritis and eventually stomach cancer. Silent acid reflux can lead to Barrett's esophagus disease, and Barrett's esophagus can lead to esophageal cancer. Both start quietly, but both are reversible if caught early. If you've had acid reflux for months or years and you're still trying to get to the root of your problem, we made a free quiz for you. Head to myacidrefluxquiz.com, fill out that short quiz. It will tell you what's most likely causing your issues so you can start taking things for it and finally fix your reflux and go back to eating what you like. I make videos here every single week. Please subscribe so you don't miss out, and I'll see you in the next one.